So I'm LePage. I live in, a smaller town in the middle of the state, so a little bit more rural community. And I've spent the last 9 years working in the anti-trafficking work with youth, young people, vulnerable adults. And I came in as one of our regional navigators. I covered both the east central area of the state and the northwest area of the state, which is 20 counties. I really wanted to take my perspective and my history of working with young people and providing preventative education around a number of topics and vulnerabilities, and bring that to this committee, since this committee had the impact of not just addressing certain pockets of population that we oftentimes get in front of as victim service-based professionals, but also our more mainstream population that sometimes gets left out of the conversation, where they're still being impacted by pretty significant risk factors. And I really wanted to bring my perspective because in my work, I am seeing larger and larger numbers of young people being impacted really greatly by various risk factors and vulnerabilities. I think that as somebody that has worked, for nearly a decade trying to get in front of young people, there's a lot of barriers to providing resources, services, education, comprehensive education. There hasn't been a huge focus until recent years of really developing evidence-based learning practices, curriculum materials, prevention educations. And so there's been a huge shift in what we know about victim-based crimes. And again, the health standards is so huge and there's so many components to it. And I, of course, come with my very specific point of view, understanding how the vulnerabilities of substance use are impacting young people, teen dating violence, violence within the home. So violence prevention was my main area of focus. But also I see a lot of concerns with kids not really understanding consent, or not knowing about their bodies and how they work, and how that can impact, how their choices can impact things in the future for them, because they don't have comprehensive understanding of their own bodies and of health. And so it was really important for me, and I think anybody that has a unique or focused perspective of areas of topic that are being pushed through in new standards, it's really a benefit to hear that point of view, because again, a lot of people that are in education don't work in that all the time, and so they're not abreast to all of the changes and trends and needs of young people. I definitely plan on using this process and continuing my education with this process in future endeavors as well. I think it gives much better insight as I'm out in communities promoting prevention education. It gives much better insight into how we can move forward, and also why we can't move forward in certain areas as well, or why it's more challenging. So yeah, I think it gives huge insight, and just honestly knowing what our kids are learning in schools as a parent is really beneficial to me, and that's something that I take to heart, and I'm proud to have learned more about. But also, just in working with young people and trying to partner with the education system, it's so important to know different grades that people are supposed to be learning different things, so that as professionals coming in, we can cater what we're offering to what the schools are already trying to accomplish. It didn't necessarily surprise me, but what really inspired me was the fact that we successfully had people from all different areas of the state, different focuses, different backgrounds, different stances on the issues, and we were all able to really successfully come together and find middle ground and really root ourselves in our end goal, which is having better and healthier systems and spaces for young people. We want young people to have the tools to have healthy lives, and rooting ourselves in that really was inspiring because we were able to come together collectively, even though we had different points of views coming into the room. You have to start out by taking some time to learn. Every process, every system has expectations, but also limitations and work that runs parallel to it. And so taking the time to really understand the systems that we're trying to create adjustments within is a really good first step for people. And I think that anybody coming in, please take some time to really understand the process of developing standards and their intent before jumping in. It's really important to remember that the work we're doing is not for one person, one community. It really is for the collective around the state. That means that we have to be ready to compromise. Compromise is a huge part of any collaborative effort. And there's different communities, there's different young people that need different things. One size doesn't fit all. And so having broad enough language and intention really helps us come together and one, compromise, but also create the best tool for people throughout the state, not just one area and one need. It's so important to have a broad perspective, particularly for some of these other areas of education that aren't as maybe black and white, that are still really, really evolving. Again, a lot of areas of our health standards are issues that are constantly evolving and changing. And so having expertise on those different topics in the room is of benefit to our educators and helping them understand the trends and how to focus their efforts on the development of their curriculum, but also the youth. We don't want to create materials or standards that aren't applicable. Youth are often talked to by adults or talked at by adults, and we really want to create systems and education that are built for young people, and that takes them into consideration, and again is applicable to what they're going through as young people. The one thing I would really love to see more of moving forward with these committees is a more complete picture of the entire state. I think it's hard because traveling to the metro, if you're an outstate community member, is an ask and it's a challenge. There's definitely resources to make it more feasible for people. So just know that those resources exist, and having outstate perspective is really important when you're creating a statewide response.